Good morning, all. So, today our presenter is Dr. Sudha. So, here I give an introduction about our presenter today. Dr. P. Sudha, an assistant professor in the Department of Biomedical Engineering from PSNA College of Engineering and Technology, Dindigul. She graduated as Electronics and Communication Engineer from Periyar Maniammai College of Technology for Women, Tanjore, and completed her post-graduation in ME Applied Electronics from RVS College of Engineering and Technology. In the year 2019, she completed her Doctor of Philosophy in the field of biomedical signal processing and published 13 research papers so far. She has 15 years of experience in teaching, and her special interest in the area of engineering includes electronic circuits, rehabilitation engineering, biomedical signal processing. I welcome you all on behalf of our biomedical engineering department, ma'am. Please, I proceed the session.
Thank you, ma'am. Thank you. Thank you very much for your intro.
Yeah, welcome.
Good morning, all participants. I'm Dr. Sudha, Assistant Professor, Department of Biomedical Engineering at PSNA College of Engineering Technology, Dindigul. So first of all, I would like to thank our management principal and our HOD to giving me an opportunity to present Sttp program. And my presentation is about electrocardiogram signal processing and analysis. I know the participants are all from different diversified field that is branches different from different branches and different fields. So I am going to start with the basics of ECG and how the signal processing can be done. Basic concepts behind the ECG signal processing and the analysis part. Okay. I'm going to cover what is ECG and ECG, about ECG signals, ECG signal, then finally the application of ECG signal. We know ECG is an electrocardiogram, is called as actually a representation of electrical activity of the heart. So it displays voltage difference in between a pair of electrodes. That is actually called as muscle activity. It measures muscle activity. So that's why it is the representation of electrical activity of the heart. So from the ECG, you can get overall rhythm of the heart and weakness in different parts of the heart. So it is the best way to measure and diagnose abnormal rhythms or abnormality in the heart. See, before going into the what is ECG signal, you should know how that is generated. You know, the heart is having 4 chambers, and there are natural pacemaker. Pacemakers like AC and sino-arterial node and AV node. And see, the first picture image shows the atrial depolarization that is initiated by the SA node, and that causes P wave. So you know what is ECG? So it is actually generally it is called as PQRST wave. So how the PQRST wave is generated inside the heart? You see, See, first, the SA node is a natural pacemaker. It generates impulse. After that, if we initiated, yeah, it will depolarization takes place. That causes P wave. And the second comes to the second one. See, the impulse is delayed at the AV node. With this, the atrial depolarization completed. Then, and the third part is the ventricular depolarization begins at apex. So it is shown here. The first, the SA node, from the SA node, the atrial depolarization takes place, and then next, the AV node is denoted here, and that is actually the completion of atrial depolarization. And third one is the ventricular depolarization begins at the apex. That causes QRS complex. So it is actually there atrial repolarization occurs. Then next one, ventricular depolarization is completed. Okay, so that is actually shown with the help of that QRS wave. And the fifth one is ventricular repolarization begins apex and causing T wave. The finally the T wave the repolarization is completed. Okay, don't confuse with what is depolarization and repolarization. See, it is actually polarization is contraction of muscle, and repolarization is nothing but relaxation of muscle. So this is actually a general ECG wave.
சொல்லுங்க மேம்.
The peak ST wave.
சார் வந்து டிபார்ட்மெண்ட் வரைக்கும் போயிருக்காரு.
And
இங்க தான் இருக்கேன் நான்.
in when a person is undergone to examine ECG waveform.
அப்படியா? அவ வந்திருக்காளா?
Okay. So it is actually recorded. That is shown.
Yeah.
Shown here with the help of a box, a big box.
சரிங்க. சரி. சரி.
So the P wave and QRS wave and T wave and U wave. So there is an amplitude and the time interval for this ECG waveform. Okay. So here I could explain. So see again how the ECG waveform is generated. So the P waveform is that represents atrial depolarization, and the QRS represents ventricular depolarization, and T wave represents ventricular repolarization. And U wave is due to repolarization of Purkinje fibers. You know, and see, the contraction is, as I said, contraction is nothing but depolarization, and the relaxation is nothing but repolarization. So these changes, these contraction and relaxation occurred in the muscle of heart that causes electrical changes that can be detected with the help of electrodes which are attached on the surface of the body, especially in the it is going to be explained later. See, surface of the body general. Okay, and normal ECG. See, normal ECG. See, the waveform is in terms of it is in terms of time and amplitude. It is in terms of time and amplitude. So the amplitude of P wave is 0.25. It is for normal ECG, millivolts, and the R wave is 1.6 millivolt, and Q wave 25% of R wave, and T wave is from 0.1 to 0.5 millivolts. And there must be an interval for PR. There is a duration for all the intervals: PR interval, QR interval, and ST interval, and P wave interval, and QRS interval. So PR interval is in between 0.1 to 0.2 seconds, and 0.35 to 0.44 seconds, and 0.05 to 0.015 seconds, and the P wave interval is 0.11 second. So, according to the time interval, the frequency range of ECG is from 0.05 hertz to 100 hertz. The range of 1 millivolt to 10 millivolt ECG range. Okay, so what I'm saying is that see with these values, nominal values only, we can go for classification or protection of abnormalities in ECG waveform. So we should keep in mind of amplitude and duration and the frequency while going for the signal processing. That's why I'm starting from the basic things. And then why ECG? See, if a person has symptoms like chest pain, heart failure, collapse, or syncope, that is actually called as loss of consciousness, shock or hypotension, palpitation, that is actually plus fast beating, cardiac arrest, and pre-operative process. Okay. So if a person has these symptoms, any one of these symptoms, the doctor advised to get ECG first. Then, if the ECG is normal, till he or she is having some problem, see, he is advised to get echocardiogram. Okay, so the first thing is the first suggestion of the doctor is ECG. Since because an electrocardiogram, so it is actually non-invasive, and heart problems in all age of people can be done with this. So, and the thing is, next one is to determine or detect abnormal heart rhythm, that is what called arrhythmias. And the second one is if blocked or narrowed arteries in our heart, that is actually coronary artery disease, can be identified with the help of electrocardiogram signal. With ECG, what can be identified? So, as I said, arrhythmias, cardiac arrest, heart block, the myocardial ischemia and myocardial infarction, pericarditis, chamber hypertrophy, electrolyte disturbances, that is hyperkalemia, drugs toxicity, that is due to drugs, prolonged QT interval may occur. Okay. So these are all the abnormalities that can be identified with the help of electrocardiogram signal. We'll see we'll see one by one about these abnormal things, arrhythmias, heart, cardiac arrest, and cardiac blocks, and symptoms of the same. So, according to the arrhythmia, if we come for arrhythmia, the abnormal rhythm, should know what is rhythm. So, the heart pumps blood at fixed rate only. So, for normal rhythm, so that is at fixed rate. So that maintains constant cardiac output. So that is actually peak arrest wave. So the single peak arrest wave can be it is an one beat. It is one beat. Then arrhythmia. See, it is a problem with the rate of rhythm of the heart. See, if the rate of rhythm is varying, that is called as arrhythmia. So during arrhythmia, heart can beat too fast. The condition is tachycardia. Say that the abnormal condition is called as tachycardia, and beats too slow. So that is called as bradycardia. Then come for cardiac arrest. It is a sudden loss of blood flow resulting from the failure of heart. So it is actually generally it is loss in pumping of heart. So the signs of symptoms of this cardiac arrest include loss of consciousness, abnormal or absent breathing, and individuals may experience chest pain, shortness of breath, and nausea. That is before a cardiac arrest. So it is actually if the failure of heart to pump effectively, that is actually called as cardiac arrest. And a heart block. So that is this occurs when electrical signal is slowed or stopped. See the symptoms of heart block, chest pain. Again, it is shortness of breath and feeling very dizzy, suddenly standing up from a lying or sitting position. So this is caused due to caused by having low blood pressure. This was what called hypotension. Okay? The third abnormal thing is. Then fourth one, myocardial ischemia. See, it is actually a condition of inadequate blood supply to one bloodstream. To an area of tissue. So it is shown by the picture. See the artery. See if plaques form in lining of artery, then that grows. Second, and grows, and so the blood clot forms, limiting blood flow. See that is actually so that is actually called as myocardial ischemia. So any inadequate blood supply to an area of tissue due to plaque grows in the artery. And myocardial infarction, again, it is a blockage of blood flow to the heart muscle. The symptoms are tiredness or pain in the chest, neck, back or chest, neck, back or arms, as well as fatigue, and abnormal heart beat and anxiety. Then next abnormal condition is pericarditis. It is due to inflammation of the pericardium. She produces chest pain. It may cause due to the viral infection, and that is shown by the help of ECG. So see that causes that there is an impact of pericarditis in ECG. So when recording it, we have a 12 lead system. Say in that there is an lead ABR. So in that position, reciprocal PR elevation and ST depression in ABR. If there is a pericarditis, this is actually these are all the case which is coming under in V5 the interval PR depression and ST elevation occurs. Okay? So the abnormal conditions that have impact on the ECG waveform. So while recording ECG, so the recording of ECG is very important, and then we'll see to diagnose a person with the ECG. There is an we need the quality of ECG signal. So so these are all the things we need. So before that, you should see before that you have to acquire the signal correctly. Okay, so that's why I'm saying what are the abnormal things which are there in regarding cardiac problems, and how that affects ECG waveform. And next abnormal thing is chamber hypertrophy. So there are 4 different chamber hypertrophy. See, that is actually hypertrophy is enlargement and thickening of walls and pumping chamber. Left ventricular hypertrophy is an enlargement or and thickening of the walls. Okay? And this can be shown here. So this is actually left ventricular hypertrophy. So the second image, this is actually normal heart. So with all chambers, right atrium, left atrium, right ventricle, left ventricle, and aortic valves, mitral valves, coronary artery, and aorta. See here, this that arrow shows you hypertrophic left ventricle. That means that thickness of wall, ventricle, left ventricle wall. Okay. So see, you can see the difference between this normal the wall thickness and abnormal wall thickness. Okay. And right ventricular hypertrophy. See, it is again the thickening of wall in the right ventricle. Okay. See the ventricle wall. See here the thickness is very. It is normal. Here the thickness of wall is high. Okay. So it is called as a right ventricular hypertrophy. And again, coming to the next 2 chambers, right and left atrial. See if so there are 2 different cases. One is the right atrial enlargement and left atrial enlargement. Okay. See the first diagram shows you that is sorry. Picture shows you a right atrial enlargement. Okay, see that red arrow. This is that right atrial enlargement, and the left one, left atrial enlargement. Okay. So the same, see that is actually the anatomical picture, and below that you could see what are the impact on ECG. So while taking ECG, when at lead 2, if there is a right atrial hypertrophy, say this is the waveform. There is a notch. Okay, and lead V1. The P instead of P wave, there is an again negative waveform is there. Okay, and the left atrial hypertrophy, again the prolonged interval, and here in lead V1, and there is a negative waveform. Okay, so these enlargement again gives impact on ECG waveform while recording it. And left and right signal. Okay. See here the interval of in V5 the R in R in V5 is 26 mm and S in V1 is 15 mm. So the sum is 41. It's more than 35 mm. So the doctor can give a suggestion that he's having LVH, that is left ventricular hypertrophy. And so if the person is having right ventricular hypertrophy, the R wave is greater than the S wave. So from that, the suggestion is given like RVH. The person is having RVH. Okay. So these abnormal conditions make some impact on generation of ECG waveform. Okay. Abnormal condition, hyperkalemia and hypokalemia. See, hyperkalemia is high potassium level in bloodstream, and hypokalemia is deficiency of potassium in the bloodstream. Okay, So again, the waveform for that particular abnormal hyperkalemia is given. So see, this is actually normal waveform, and if a person is having hyperkalemia, see this, we could see ECG waveform like this. The P waves flatten. Okay, for long period in the sense the interval extent, okay, than the normal one. And then see, another symptoms may appear, that is actually is, yeah. Okay, so potassium level in blood have impact on ECG signal. Okay, so see, in hyperkalemia, the and the P wave disappears. May occur when the person has deficiency of potassium. Again, it has impact on ECG.
Sriram sir, can you hear me, sir?
Ma'am?
Yes, ma'am, you are co-host now. Sorry for the interruption, ma'am. You can proceed now with your presentation, ma'am.
Okay, thank you.
Dear participants, sorry for the technical issue. Please proceed with your listening. Thank you all.
Okay, is it visible? Ma'am, is it visible? Screen is visible, ma'am?
Yes, ma'am. It is visible, ma'am. Visible.
Okay, okay. So till this hyperkalemia, so you have received, no, Shiva ma'am? Or I have to explain from the previous slide.
No problem. You continue on the slide, ma'am.
Okay, okay. Okay, so hyperkalemia, it is high potassium in our bloodstream, and that has impact on ECG waveform. Then hypokalemia, deficiency of potassium in the bloodstream. So the first A is normal complex PQRS complex, so that is ECG complex. And the second one, say it is prominence of U wave. So you could see, so the T wave is prominent than U wave in normal, but in abnormal, if if a person is having hypokalemia, the U wave is prominent than T wave. And sometimes in the next one, sometimes T wave disappears and U wave is prominent. So, so again, the deficiency of potassium have impact on ECG waveform. Okay, so from that, the doctor can give about the person abnormal condition. Okay, then cardiac arrest, as I said, the sudden loss of blood flow resulting from the failure of the heart to pump effectively. And the signs are caused loss of consciousness and shortness of breath. And in general, I have given all these things like arrhythmia, cardiac arrest, heart block, and all. So let's see what are the arrhythmias, specific arrhythmias, common cardiac arrhythmias, and their waveform, ECG waveform. See, I am why I am saying about the ECG waveform and their abnormal things is that, see, there is an impact on every abnormal things, impact on ECG due to abnormal heart function, and that should be identified with better quality. With better quality only it can be diagnosed. And there must be a signal processing technique that must be must have good accuracy and good sensitivity too. That's why I'm going with the starting, and that is from the basics. I'm doing it. Okay, and common cardiac arrhythmias are atrial fibrillation, atrial flutter, supraventricular tachycardia, ventricular tachycardia, acute coronary syndromes, including angina and angina and myocardial infarction, and pericarditis. And again, the tachycardia, sinus tachycardia, supraventricular tachycardia, and the atrial flutter. Let's see about the ECG appearance when sinus tachycardia is presenting, is there for the person. So this is actually a waveform of sinus tachycardia, the abnormal waveform of for the sinus tachycardia. See here, what are the things that are coming when across this inside this sinus tachycardia? See, there's a regular rate of heart, and that is heart rate, BPM, that is beats per minute, and normal appearance of P and QRS wave and T wave, but QRS may be widened if it is associated with the conduction defect, that is bundle block, bundle branch block. Okay, so the impact is QRS may be widened in sinus tachycardia. And supraventricular tachycardia. So here you can see in the circle it is shown hidden or absent of P waves. You could see so you only have a QRS wave, absent of P wave. That's arrow shows you absent of P wave, and regular QRS complexes are there, and normal QRS complex in the absence of bundle branch block and normal T waves. These are all the characteristics of supraventricular tachycardia. Okay, so there is appearance of ECG appearance of SVT. Okay, and atrial flutter. So here, see the appearance of ECG flutter, that is characterized by P waves at the rate of 300 BPM, that is atrial rate, and it is like a sawtooth waveform. Okay, you could see it is like a sawtooth. Okay, P wave is not like a smooth waveform, that is like a sawtooth waveform, and regular QRS complex, and normal T waves too. Okay. And a QRS rate, say for on conduction through the atrioventricular node, if AV node, if every second P wave is conducted, and the QRS rate will be 150. If every every third P wave is conducted, the QRS rate will be 100. So these are all the characteristics of atrial flutter. Okay. And atrial fibrillation. It has variable ventricular rate. Okay, you could see the difference in between the normal and abnormal atrial fibrillated ECG waveform, and absence. There is no P waveform, and erratic baseline between QRS complexes. So the erratic baseline between QRS complexes, and narrow QRS complexes in most cases. So in the previous case, that is actually normal, and so in this atrial fibrillation, the narrow complex is there, QRS complex. Okay, and bundled branch block is present, and normal T waves. Okay, these are the characteristics of atrial fibrillation. And ventricular tachycardia. So the appearance of ventricular tachycardia is shown. So it is not like ECG waveform. There is no QRS and all. See no P wave, and so regular actually, but it is not having particular correct interval. Okay, wide QRS complex, and no T waves, identifiable T waves. There is a QRS complex, but not having normal interval. Okay, so there is no P wave, and wide QRS complexes, and no T waves in ventricular tachycardia. And ventricular fibrillation. So the characteristic is first one is irregular undulation, that is movement, and no clear-cut ventricular complexes, and varying ECG amplitude. So it is like a noise. Okay, so irregular movement is there, and there is no complex QRS complex, ventricular complex, and there is no varying ECG amplitude too. Okay, so these are the characteristics of ventricular fibrillation, abnormal condition of ECG. And next, asystole, lack of PQRST wave, and lack of irregular movement, and flat line appearance. Okay, if you see from the waveform, you could see flat line is there, and there is no PQRST wave, and irregular movement. Okay, so these are the characteristics of asystole, that is normal abnormal condition of ECG. And coming to the block, first degree block, see, and there is a normal P wave and prolonged PR interval. So there is you can see here. So the interval in between the P wave and the QRS that is prolonged PR interval is there. P and R, the interval is higher than the normal. Okay, and normal QRS complexes and T waves. Okay, see if a person is having first degree heart block, so these are the characteristics. You could see these different abnormalities or abnormal things inside this ECG. That is prolonged PR interval with normal P waves and normal QRS complexes. And coming to the second degree heart block. See, normal P wave, and again lengthening of PR interval, and normal QRS. Again, so the interval is it is higher than that of first degree heart block. Okay, there is a difference. And the third degree, that is complete heart block. See here, it is very, the image is very tiny. Sorry. See the normal P wave present, and a lack of association between P waves and QRS complex, and regular ventricular rate. Okay, and there may be a narrow or broad QRS complex. So you can see here, it is very tiny. See, these are all the characteristics of third degree heart block. Okay. See, see, the first thing is lack of association between P waves and QRX complex, and QRX complex may be narrow or broad, depending upon the person condition. Okay. See, till now I have come across what is ECG, how the ECG waveform is generated, and what are the abnormal things, and how abnormalities in the ECG waveform, and what are the characteristics of abnormal ECG waveform, how they are having impact on the ECG waveform, abnormal things that are having impact on the ECG waveforms. Okay. See, then next I'm moving to the signal processing. So due to that, minimum range of amplitude and the time interval, and to find different abnormalities, you should go for ECG signal processing. Okay. If it is recorded, okay. So if through naked eye, all the things cannot be, all the ECG waveforms cannot be identified with abnormal things. Okay. So while doing processing, we have to consider some of the steps to get better quality of ECG signal, better accurate and good quality of ECG signal, okay, reliable one. So the first thing is, what are the steps you have to follow? Means that first one is the classical model features of interpretation of ECG signal you should know, and second one, ECG signal acquisition system. You have to know about ECG signal acquisition system, and third one is techniques for noise suppression for ECG signal processing, and fourth one, techniques for QRS complex detection, and fifth one, detecting and delineating P or T waves, and next one is issue of automatic classification of heartbeats. These are all the things you have to keep in mind while before getting or diagnosing ECG signals with abnormal things. Okay. See, first thing is classical and modern features of interpretation of ECG signal. Okay. See, it is there. It is for long-term monitoring examination. First one. And the second one is it is used to diagnose arrhythmias and conduction disturbances. And third one is, see, the reliable assessment is only depending upon the quality of the signal recording. Okay. And the accuracy of extracting all the features of ECG signal. Okay. And next one is automatic delineation of that is prediction of ECG characteristic waveforms, and the quantitative analysis of time series and amplitudes derived from ECG segmentation. These are all the things you have to keep in mind while considering while going for ECG signal processing. And one more thing is automatic extraction of this signal. Okay, see, that provides better quality than the non-automated things. Then Next step is ECG signal acquisition system. Okay. See, if uh, we get ECG signal from the database, it's okay for analysis purpose. If you are doing it as a real time process, we should know what is know about the acquisition system. Okay, how it is acquired and what are the lead systems available and basic circuits available to acquire ECG signal. Okay. See, first thing is a conversion between ionic to electric cardiac currents at the electrode patient interface. That is very important. That is actually there in ECG signal acquisition. So electrode placement is by placing electrodes, ECG signals can be acquired. Okay. So with the help of electrical activity of heart muscle. Okay. Then second one, lead system configurations. And third one is base ECG acquisition system circuit. Okay. These are the things you have to keep in mind before acquiring ECG signal. Then you know what number of electrodes are there, and mainly surface electrodes are used to acquire ECG signal. And so the leads are nothing but it is used to measure the difference in electrical potential between 2 points. So it is the ECG is acquired with the help of electrode, not with the help of sensors. Okay, so it is actually this electrode is picking up the electrical signal from our body, from the surface of our body. So for that we need leads. So then only could identify or you could get difference between electrical potential between the 2 points. Okay, and there are standard ECG leads that is called as 12 lead system. Standard ECG lead system. So 3 standard limb leads. So standard limb leads are 3 leads, and augmented limb leads 3, and precordial leads 6. Okay. This is all the leads. This is actually it's all coming under 12 lead system. This what is standard? See what is standard limb lead? So lead 1, lead 2, and lead 3. So lead 1 is connected between right arm and left arm, and lead 2 in between right arm and left leg, and lead 3 in between left arm and left leg. Okay. And augmented limb leads are AVR, AVL, and AVF are used to get ECG signal with these different degrees. So here again it is there about the first lead and second lead and third lead. And precordial leads, there are 6 leads: V1, V2, V3, V4, V5, and V6. See, this is actually mid-clavicular line and mid-axillary line. See, the first V1 is placed at the 4th intercostal space at the right sternal border. See here, 4th, 1, 2, 3, 4, 4th intercostal space, and V2 4th intercostal space left sternal border. So here 4, 1, 2, 3, 4, and left 1, and third V3 halfway between V2 and V4, and between V2 and V4 it is placed, and V4 is placed on the 5th intercostal space and left mid clavicular line. So you can see V4, and V2 is V3 is in between V2 and V4. Okay, and V5 it is halfway between V4 and V6, horizontal with V4. That is at the anterior axillary line. V5. At the anterior axillary line, it is placed in between V4 and V6. And V6 horizontal to V4 at mid axillary line. So horizontal to V4 at mid axillary line. Okay. So actually the position of precordial leads, that is electrodes. Okay. Using this, the person get ECG waveform as a snapshot record and with all these things, lead 1, lead 2, lead 3, AVR, AVL and AVF, V1, V2, V3 up to V6. So while we are getting ECG waveform, if you see in the record paper or the snapshot record paper, if you see all these 12 ECG waveforms, 12 lead ECG waveforms, right? 1, 2, 3, and AVR, AVL, and AVF, and V1, V2, V3, V4, V5, and V6. From that, the doctor can predict the abnormalities. Okay. And after acquisition, using this is actually basic and standard lead system. And after getting it as a real time, after getting the ECG signal as a real time process by using 12 lead, see before processing it or before getting about the abnormal things into the ECG signal, should go for the noise suppression. Okay, so there are many noise and attenuation there in this ECG signal by acquisition, and different filtering processors are there to suppress these noises. Okay. So basically, noises in ECG waveform are main 4 different noises which are impact or which are inside the ECG waveform are baseline wandering, power line interference, electromyographic noise, electrode motion artifacts. So what is baseline wandering? See the patient movement, including breathing, that may cause baseline wandering. You'll see what is baseline wandering in the graph. See the graphical representative, we will see it in the next slide. Okay, and power line interference and 50 or 60 hertz noise from main supply. Then electromyographic noise due to electrical activity of muscle, and electrode motion artifacts, that is skin stretching, which alters the impedance of the skin around the electrode while acquiring ECG signal. Okay, so that's why I am saying that she have clear idea about the abnormal things which are abnormal characteristics of abnormal things inside this ECG appearance. That's why I have taken all these things inside previously. So then only you can go for protection of abnormal things. So we cannot directly go for the protection of abnormalities in ECG waveform. So if we are doing it as in real time, from acquisition is very important. Okay, then after acquisition, pre-processing must be there to avoid these noises. Then only you can identify or you can classify or you could see abnormalities inside this ECG waveform, acquired ECG waveform. Okay, so baseline wandering, so it is due to a patient movement, including breathing, and power line interference 50 to 60 hertz noise from main supply. So since we are using not to record the ECG waveform, we need supply, main supply. So from that, if you get interference inside this ECG waveform recording, then electromyographic noise, so electrical activity of muscle, even heart, and electrode motion, see motion artifacts, the movement of the patient while acquiring the signal. Okay, so like skin stretching itself alters the impedance of the skin around the electrode. Okay. So you see, what is baseline wander? So it is due to either due to the breathing of the patient. Okay, you can see here. So there is, it is not coming like in a straight line. Okay, horizontal line. Okay, see, it is due to the breathing or patient movement. Okay, and the second one, see this ECG waveform shows us power line interference. In the ECG, which is affected by power line interference. So you could see the distortion here, the dark one, and ECG signal with EMG noise. So there must be a muscle activity, and that is inside that ECG signal too. So if you see here, and ECG affected by electrode motion. So it is like it is fully drift. It is having drift. That is, it is not coming under a straight original line. Okay, so these all are the waveforms. Sorry, ECG waveform with different noises: baseline wandering, power line interference, and EMG noise, and with motion artifacts. Okay, so these, after eliminating these interferences only, you can go for next one, QRS complex determinations and complex detection and heartbeat detection and abnormal detection. Okay. So pre-processing steps for to remove baseline wandering is with the help of high pass filter. Okay, since baseline wandering is due to, see, the breathing, the frequency of breathing, respiratory frequency of this breathing is 0.5 to 0.6. So you have to remove that noise with the help of high pass filter. Okay, they had a cutoff frequency 0.5 to 0.6. So the baseline wandering can be easily removed with the help of high pass filter with cutoff frequency 0.5 to 0.6. Why you have selected 0.5 to 0.6 in the sense the noise due to breathing is about 0.5 to 0.6 hertz. Okay, and power line interference, power line is either we are using in India, we are using 50 hertz, and USA and all 60 hertz they are using. So either 50 hertz or 60 hertz cutoff frequency with notch filter with 50 or 60 hertz cutoff frequency can eliminate power line interference or can remove a power line interference. And then EMG noise. It's a high frequency noise. It is about 100 hertz. You know what is EMG? Electromyographic noise. So that can be removed by low pass filter. They correct that particular cutoff frequency. And final one, the motion artifacts must be minimized by suppressing the movement of the subject only. Okay. Then, so far discuss about how to acquire general acquisition system and lead system to get each accurate ECG signal, and for the noises which arise while recording it, basic noises, and how to eliminate, what are the causes of that noises, and how to eliminate that noises. Okay, then so that is coming under pre-processing step. So after doing it, we can go for QRS complex detection. Then only you can find heart rate of the particular ECG waveform. Okay, there are number of QRS complex detection. So I have listed some of the methods to detect complex QRS complex detection, Pan-Tompkins algorithm or a slope, and the sixth power algorithm, final state machine algorithm, difference operation algorithm, optimized knowledge based algorithm. And you can select whatever it may be. So by see the methods can be evaluated by finding sensitivity and positive predictivity of the particular algorithm. Okay, by finding false, true, false, and positive, true, positive, and true, negative, and false, positive, and false, negative, and detecting and delineating of PR T waves. So you could see there is an there is an important the identification of PR T wave is very important to find particular abnormal things inside the ECG. So that is also important to detect P waves and T waves. Okay, and see if P wave is absent, we could say that the person is having atrial fibrillation. So and atrial fibrillation, ischemia, stroke, thrombus, and other emergency medical interventions can be detected with the help of PR T waves. So detection of PR T wave is also important. Okay, there are many algorithms to find the PR T waves. So the particularly to find QRS heart rate, QRS complex is very important. Okay. Issue of automatic classification of heartbeats, the final one. See, see if the increase in number of individuals suffering from heart disease. So automatic classification is needed for treating them and diagnosing them. Okay. So then they can the abnormalities can be detected, and the patient can be uh, there is a patient can be treated. Okay. And see the early, and one more thing is early detection is very important before uh, early and accurate detection is very important when a person is having arrhythmia attacks. Okay, so automatic classifications can be done with the help of machine learning and deep learning, the help of artificial neural network, and that I am not going to going into the neural network. Just I am saying that using artificial neural network can classify ECG signals, a number of more number of ECG signals automatically. Okay. So as Monica said, there are neural network, artificial neural networks, inputs and weights, and there is a bias and outputs, threshold functions and outputs. Okay, with that, the machine can be trained, and the prediction can be easily done automatically. Okay. So see why we are going for a neural network, in the sense it is actually the main feature of the ANN is parallel processing of signal. Okay. And errors can be easily diagnosed with the help of this artificial neural network. So you can use this as a method to identify abnormal ECG waveforms automatically. Okay. So far I have discussed about basics abnormal basis of ECG, abnormal waveforms and their characteristics, and signal processing, real-time signal acquisition processing, and the algorithms to find the QRS complex. See, next thing I would like to say about an application of extracting ECG signal. So the extraction of fetal ECG from abdomen ECG. See, see, this is actually why instead of number of modalities can be used to find the status of the fetus, like mainly ultrasound. Okay, but why we are going for the fetal ECG extraction for the pregnant women, in the sense, so during labor time, and before pre-labor, it is very useful. So while he's here, that she's uh, uh, under the condition of critical. Okay? So, she's under a critical condition. It is very important to get a fetal ECG, to get status of fetal ECG. So, uh, see, fetal ECG extraction is very important. Uh, and detection of abnormalities is also important to safeguard both fetus and mother, both child and mother. So there are a number of algorithms which are available, and so after designing it, you can go for wearable device also. See, what are the I'm going to say what are the existing methodology to extract fetal ECG from abdomen ECG. See, see, this is abdomen ECG is can be driven from on the surface electrode, which is placed on the mother abdomen. See, after getting it, it is the combination of both mother and fetal ECG. From that, we can easily extract fetal ECG. Easily, not easily. So you can extract fetal ECG, the ECG, the help of signal processing techniques. So there are a number of existing methodology: adaptive noise canceller, Kalman filter, blind source separation method, neural network, and fuzzy independent component analysis, that is called ICA and natural gradient algorithm, and single value decomposition and LabVIEW also. So the objective of this extraction is that, as I said, is to detect, is to get reliable information about fetal status during pregnancy or during pre-labor, and see, that is actually to detect abnormalities, that is what called congenital heart disease, arrhythmia, uterine fetal retardation, hypoxia, and to determine twin pregnancy also, and measure RR interval fetal heart rate and beat to beat variability. So if an abnormal things can be identified, therapy can be done with the help of by giving drugs to the pregnant women. So it is used to avoid stillbirths also. So yeah, see, I have take actually it is my research area. See, I have taken abdomen ECG from the Physionet database, and after taking that signal from the database, it has noise too. So that is pre-processed, and after that, it is subjected to adaptive noise canceller techniques and wave transfer. So by using these two wave methods, I have done the extraction of fetal ECG from the abdomen ECG. In the database, there is a thorax signal as well as mother signal. Abdomen signal. So by using thorax signal as a one input signal and abdomen signal as the other one, by giving us the feedback, can be extracted. Fetal ECG can be extracted by using adaptive filtering technique. So here I have given abdomen ECG. Okay, so after abdomen ECG, after removing it, see, it is looking like this, and after removing baseline monitoring, and after removing 50 Hz noise and baseline monitoring and EMG noise. And mother ECG, how to pre-process the mother ECG too. And after giving these two as the inputs for the adaptive noise cancelling techniques, noise can be cancelled. And again, the noise inside that extracted signal again processed with the trimmer to get exact ECG signal. Okay. And I have used a fetal ECG extraction with, I have used wavelet transformation technique for the extraction of fetal ECG. Again, using a DWT, have done this extraction. Okay. Again, the starting, the abdomen ECG must be pre-processed and then subject to the wavelet transformation, and get the final fetal ECG from that. See, abdomen ECG must be pre-processed. Then only can get a fetal ECG accurately. Okay. Then I have after extracting by finding QRS complex, I have done heart rate prediction for both adaptive filtering and wavelet transformation. I have taken number of events, events in the sense number of abdominal and thorax signals, and for the mother signal, I have calculated heart rate and fetal heart rate too, and for it is tabulated here. So from the database for 10 seconds, abdomen and thorax signals have been taken. So these are event 1, 1, 2, 1, and all. So for that first event, see the 78 is the mother heart rate, and fetal heart rate for that event is with the ANC, there is adaptive noise cancellation, it is 132, and wavelet 134. See, it is actually the fetal heart rate is actually double that of the mother heart rate. Okay. So see, it is clearly shown. I have taken normal waveforms only. So see, it gives us normal heart rate of fetal ECG, okay? Fetus, normal heart rate of fetus. Okay. As I said, it is fetal heart rate is in between 120 to 160. That is actually the rate is twice that of maternal heart rate. Okay. And see, another important thing is to find fetal ECG is that you can get heart rate variability too. So by finding standard deviation of normal to normal and standard deviation ST and an index and root mean square of successive differences can be analyzed with help of HRV analysis software I have done, and with the synthetic data only I have done, not real time due to ethical issues, and I am doing it now. Okay, then this is actually heart rate variability plot of synthetic maternal heart rate, and from that you can get the values of the root mean square and standard mean square. From that, doctor can diagnose the things. Okay. So the heart rate variability plot of maternal heart rate is shown here, and for synthetic data for heart rate variability plot for synthetic fetal heart rate is shown here, and the corresponding values are tabulated. And part of the I have explained part of my research work. See that what I have done is from the database I have taken number of events, and there is number of abdomen signals and corresponding thorax signals, and there is mother signal, and made extraction. And after extraction, the heart rate of fetus and as well as mother is detected and verified. And then after that, I have I have done with ASIC design of fetal ECG acquisition. Okay. So I have no time to explain that. So, see, this I'm going to conclude my talk. See, this is actually the advantages of fetal ECG extraction. See, the thing is, minute by minute information of fetal status can be again, and accurate historical information on fetal status and the duration of contraction from earlier in labor. So that is very important. And therapy can be done by finding fetal heart rate as well as beat to beat variability. See, that's why I have shown heart rate variability, and it is non-invasive method. So that's why. See, though we have a number of number of modalities to identify the fetal status, the ECG fetal ECG extra, that is ECG fetal ECG extraction is and now in online. Okay. Then application, that is it is the modest help for the mothers and babies for when uh, the mother has illness or accident. So continuous monitoring, when continuous monitoring is needed, it's very important. And second one is obese mothers are at risk of hypertension, diabetes, and stillbirth. So that can be monitored continuously with this. So using ultrasound and all, we cannot monitor a pregnant woman continuously. So we could do it with this instruction. And it is non-invasive and it is used to safeguard the mother as well as fetus. Okay, so these are the applications of fetal ECG extraction from the abdomen ECG for pregnant women. Okay. See, see this I have end my session. See, is there any doubt? You can freely ask me. Participants. Ma'am, Sudandra ma'am.
Yes, ma'am. Yes, ma'am.
So any queries from the participants?
Yeah, okay, ma'am. Dear participants, if you have any queries, you can unmute yourself and ask. Okay, ma'am. I guess there is no any queries from participant side.
Okay, ma'am.
Sriram sir, please proceed with vote of thanks, sir. Sriram sir.
Okay, ma'am. Thank you. Thank you, ma'am.
Sriram sir. Sriram sir.
He's on the line only. Okay, it's okay. No problem.
Yes, ma'am. He's not muted. Okay, ma'am. I will proceed with vote of thanks. So it is indeed a great pleasure for me to deliver the vote of thanks on behalf of the Department of Biomedical Engineering, PSNA CET. I would like to thank Dr. P. Sudha, Assistant Professor from Department of Biomedical Engineering, PSNA, so who gave a very nice talk on ECG and with the analysis using biosignals. I'm sure the participants would be highly benefited from your talk, ma'am.
Thank
Thank
you.
you for the presentation, ma'am.
Thank you, ma'am. Thank you.
Dear participants, the next session will be proceeded at 11:30. So please make sure to join on time. Thank you all.
Good morning, sir.
Good morning, madam. Good morning, madam.
Good morning, all. I would like to introduce the guest speaker of this session, Dr. K. Adalarasu, Associate Professor, E&I, Shastra Deemed University, Tanjore. He completed his PhD Biomedical Engineering in IIT Madras and MTech Biomedical Engineering in IIT Madras, and Bachelor Degree E&I in TCE Coimbatore. His area of interest are cognitive neuroscience, biomedical instrumentation, biomedical signal processing, ergonomics, human factors, musculoskeletal system. And he has published more than 40 journals. And he is being a reviewer of journals also. With this small introduction, I would like to invite Dr. K. Adalarasu to present his presentation.
Madam, my voice is clear?
Yes, sir. Yes, sir. Clear only, sir.
Okay, okay. Okay, first of all, thanks for introducing speaker today, myself. That is nice. Okay, first of all, I thanks to biomedical HOD and the organizing team members for providing opportunity to deliver keynote talk. Training program. That is nice. So today I talk about little bit about the neuroscience field. Neuroscience, mainly I concentrate most of the neuroscience that is working. So my screen is visible?
Yes, sir. Yes, sir. Visible,
Okay.
sir.
Okay. So during my talk, is some having any doubt, any clarification, you can ask. I stop my session. I can explain all the information. So what are the things today? We completely talk about the neuroscience perspective in human healthcare. How neuroscience is a crucial play role, specifically in cognitive. Cognitive, anything look like a thinking level. They can make it thinking level. How thinking level can improve or decrease due to some of the abnormal condition. That is so until whenever I talk about the cognitive, this related with your brain is related with the brain, and in neuroscience, how neurons are firing inside the brain during some task activity. They can make it. So already introduced myself, madam already introduced myself as the name. So today overview of my today presentation actually. So what are the things? First we discuss about what are the neurological disorders in present scenario healthcare system. What are the people facing neurological disorders? Different type of neurological disorders. Which are the disorders are very dominant for human healthcare side? They can make it. Next, in this some of the neurological disorders, people can mainly affect for stress and fatigue. So we talk about the introduction about what is the stress, what is a fatigue, what is the meaning of fatigue. Here, fatigue is nothing but the human fatigue, not material fatigue. We talk about the human side. What is the fatigue? Next, we can move on to the neuroscience. We can make it. So what are the neuroscience approach? We can make it. I already told them neuroscience. Whenever we talk about the neuroscience related with the brain. So what are the structure of the brain and what are the method we can quantifying the brain activity using signal imaging modality? Many techniques are there, but we discuss only signal modality, not imaging modality, to find the brain function. That is now. So this all the three topic we give the introduction about the neuroscience and cognitive, all the things. So similarly, we discussed some of the application side. What are the work already carried under me, supervisor? That is nice. So one application side, cognitive evaluation of driver performance using EEG, using brain signal, we can find out the driver performance, driver alertness state. Is a drowsy or alertness, stress, all the things we can evaluate it. Second, we can application side. We can find out the cognitive workload of the students during exam time or generally comparing within the specifically for college students. Here, this study we carried about only college students. They can find out the gender wise what is any happen gender wise. They find out the which gender having more workload is look like a high workload or medium or low workload. They can make it. Finally, I can discuss one specific application related things, a therapy, meaning we can use cognitive, meaning example, stress. So how will I can relieve the stress? Can I possible to use some musical therapy? Music can possible to use a stress relaxation. That is nice. So these are the overview of today presentation. My presentation, we can arrange them. That is nice. Okay. First, we move on to the okay. Now present healthcare system. If we move on to the any healthcare digital type nowadays, all the move on to the digital healthcare, digital technology, we can make it. So there is a two domain actually play role. One is for diseases prevention. They preventing the disease. That is some other one best example COVID now. How we can prevent the COVID situation. That is so one domain they can talk about the disease prevention. Other than community development. How we can improve the community peoples. They can make it. Another domain healthcare education. These three combined entirely scope of the health promotion. So present scenario, we can consider all the three domains. That is in healthcare education also, disease prevention, how we can preventing the disease, and community development, how will improve the rural peoples. We can talk about the meaning is a rural age peoples or rural area, how we can develop for community. That is a community development. That is we can make it. So next we want to the what are the neurological disorders can play a role. That is what are the neurological disorders can make it. Just 1 minute. Okay, so now we can comparing neurological disorders with some other disorders. Example, HIV, tuberculosis, all the thing, diagnostic disease, respiratory disease, all the thing. So in daily life, that is meaning disability, adjustment life year. We can take the disability related things. What is the comparison with the neurological disorders, brain related disorders with some other disorders? Suppose cardiovascular disorders. That is next one is your respiratory disorders, all the thing. In this graph, clearly show them. This graph actually clearly they can show what happened. Neurological disorders are very dominant in the healthcare field. Now healthcare, neurology is a crucial play role. Neurology is a very high, huge, is a large percentage. They can vary it as compared to your HIV or respiratory disorders, all the thing. That is nice. So what this actually this bar graph infer. So neurological disorders are one of the crucial play role in healthcare. We want to study the what are the neurological disorders, how we can identify the or diagnosing these disorders, how we want diagnosing disorders. Second, how will therapy after diagnosing what treatment we can make it through some drug or through some other formation. Example, some music therapy or yoga. Not only music therapy, yoga, all the thing. So one side is your drug side, is a biochemistry or some other drug design. So instead we can use the drugs, how we can improve our neurological system. That is so one way we can use a yoga therapy, other way we can use a musical therapy. That is so this slide clearly gives them now present healthcare, neurological also crucial play role. Disorder also crucial play role for your healthcare application. Just slide transition very slow. And Okay. So next, this slide actually give the neurological disorders inside. Previous slide, common neurological disorders is common. That is in this neurological disorders, there is Alzheimer's disease. They can make a cerebrovascular. Cerebral is brain vascular disease. Next one is epilepsy. Is a seizure. That is so. If we move on to the neurological disorders itself, which disorders is a very dominant? We move on to the very dominant your neurological disorder. They can make it cerebrovascular diseases. That is anything clotting the blood in the brain. Clotting the blood in the brain. That only whenever blood clotting, they can make the stroke actually. That can crucial play role. They can make it severity in stroke. They can make it. So cerebrovascular diseases, they can play role for 55% for neurological disorders. So remaining 12% Alzheimer's and other dementia. Alzheimer's disease nothing but the memory losses. If we move on to the old age people, nowadays is one of the crucial things they play role. If you move on to the age of above age of 60, this can make it. They are losing the memory. Losing memory, they are reduced. Memory can be reduced. It's a memory, recalling memory, all the things are reduced. That is so this Alzheimer's disease play role for 12%. That is if you move on to the seizure, epilepsy seizure, there also play role 7.9%, all the thing. That is so within the neurological disorder system, cerebrovascular diseases is a dominant. They can play role your system. So if they move on to the death wise, if we comparing now, if we 100 people are affected neurological disorders, how many people are death due to this neurological disorder? That is same. If you move on to the death wise comparison, if the cerebrovascular disease, they can go to 85%. It's very, very dominant. Remaining, what you do them, your Alzheimer's disease or epilepsy is not a very, very high level death. There are people not death due to this type, but due to cerebrovascular disease, that is blood clotting or where blood flow in the brain, mainly blood flow in the brain, they can make it. So this is a very dominant in the death wise. If you want a cerebrovascular disease, 85% they are contributing. That is remaining your Alzheimer's and dementia only 6.28. They can make it epilepsy only 1.86. Death they can happen. They can. So these are the surveys. These are the statistical report they are given in WHO, World Health Organization. That is they provide every year or 2 years one time. They release the report. That is if you move on to the healthcare field, that is they release all the things, not only neurological disorders. If they move on to the cardiovascular side also, cardiovascular side, what happened present in all over country, not only specific in India, all over country, how this health corresponding disease can play role. How it is dominant, how many people are affected, how many people are died, how many people are diagnosing, all the information WHO clearly they publish or provide the report. Okay. In this neurological, one thing talk about the cognitive, psychological is whenever some people is a depression or stress, they go to psychiatric. That is so whenever you go to psychiatric doctor, that is they are not using any instruments. I don't know, the people we can listen them just whenever go to so people whenever visit the psychiatric doctor or patient can visit the psychiatric doctor. Psychiatric doctor cannot use any devices. Simply they are asking questions. They are asking many questions. What do you feel? What are the things they are asking? So using the question, they are assessing your depression state or anxiety or anything they can get. So now I already informed cognitive, nothing but the brain. So brain psychology, they can study them. That is so if you move on to the taking cognitive psychological, there is a different domain spreading. They can make it. So one is for your, they can make it perception level. Next one is attention. How attention that person can do is human intelligent about them is a language processing. Next one is thinking and problem solving. Finally, memory. This all the things are crucial play role for cognitive psychology. And this all the parameters that also depending upon the which workplace environmental. Suppose we can make it one best example, workplace example. If they move on to the cockpit ergonomics, cockpit pilot, pilot they can. So pilot attention is very, very fast. They need high attention level. Reason, fraction of second. This pilot can losing his conscious. Fraction of second is it's very, very dangerous for this aircraft. That is so this only I told them depending upon the application we can concentrate. They want attention study or perception study or memory study, thinking and problem solving. Whenever go to your students level, we want to study the students level, psychological point. We can do thinking and problem solving. We can, so how they're thinking. Similarly, language side, human intelligence. So in cognitive psychology, they are covering entire things. One is a profession to up to thinking and problem solving. They can make it. Okay, now we move on to the, whenever I told them it's a cognitive brain, whenever I talk about the brain related, there one clear role is stress and fatigue. Stress is tiredness. Fatigue is unwillingness to continue the work. You are very tired. We could not possible to this. That fatigue itself, there is a physical and mental fatigue. They can make it. So whenever we move on to the cognitive side, we can study the whatever stress level of the person, or depression, or anxiety, or fatigue. They can make it. So we move on to the what is the stress? Brain. That is, stress is nothing but related with the brain. They can make it. So what is the stress is nothing but the non-specific response of the body to any demand made upon it. They can need some demand. You want make the demand, but we could not possible to do the work. One of the best example in stress level. Whenever your four-wheeler drivers or any truck drivers, they are driving around 2 o'clock, 2:30 time, early morning. That is nice. So that time is a very tired. They are not possible to drive. Reason they get the micro sleep, all the thing they can make it. So still they are ability to drive, but your body or brain cannot making this one. That is called as a stress. Stress is unwillingness to perform work. It's any demand will come, but your brain or your body cannot start to work. They can make it. So generally there is a 4 type of stress. One is hypostress, hyperstress, equistress, and de-stress. That is now. So what is the hypostress? Hypostress is nothing but the, we can generally we can make it. You are doing continuous job. It's a repetition job. What are the, whenever you are doing repetitions of same boring, look like you are boring. We can do same type of task continuously every day or every week. They can make it. They produce stress. That is called as a hypostress. What is a hyperstress? What is a hyperstress is nothing but the, they can give the more workload. They stress you. We can finish within 1 hour. I want this result. Within 1 hour, I need this report, all the thing. That time they produce stress. That is called as a hypostress. What is the equivalent? Is a short-term stress. It's not a very dangerous. First 2 are very dangerous. Third one is not very dangerous. It's a very short-term stress. Fraction of second. That's after this can be relieved. They can make it. Actually, this equal stress is a good stress, not bad stress. It's a good. It's a reason only short time. Within the 1 second or 1 minute, they can disappear. They can make it. What is it? This stress is a very bad stress. It's a long time. But stress can be in long time. Stress is nothing but the tiredness. Its meaning is, I already told them, stress is a very tiredness. They can make it. So what is it? This stress is considered as a bad stress that I already told them. Refer to as anxiety, severe trauma or mental suffering resulting from the exhaustion or accident. Whenever exhaustion of your brain, here we talk about stress is brain related things. It's a mental related thing. Whenever you are exerting the corresponding work, they produce a bad stress. That is a de-stress. It's a very, very dangerous. Another person is a de-stress or very dangerous. It's a very dangerous. So we can take care of that corresponding subject de-stress, fully relieve the de-stress, all the things can play. It's also, I told them it's an accident. They can make it. One of the better, we can take it for automobile drivers. Automobile drivers, they are acting de-stress. They can make it. It's a long, stress is long time. They are driving still. So what are the automobile driver? They are using for stress release. One of the stress release automobile driver, they're taking the tea or coffee. This tea or coffee, some of the caffeine chemical is there. They can improve the neuronal firing, neuron activity, but not particular time period only. So your caffeine or tea, they can increase the neuronal activity some particular time period, only half an hour or 1 hour only. After 1 hour, same neurons can be down. Response of the neuron, that is So what are the externally you are taken? They can give the temporary release stress temporarily they are releasing them. That is, they can make it. So already that told them equal to good or short-term stress that is strengthening us. That only is a good stress. But this stress is a very bad, it's a negative and harmful stress that causes us to constantly readjust or adapted. Hyper stress that overload when stressful events, people and strength limit of our adaptive, they can give the overload. They can more overload. So automatically the stress can be created. That type of stress is hyper stress. In hypostress, or they can make it underload to stress that causes us to bored or unchallenged. They're boring. We can do same work for 1 month or 2 months. We can make it boring. That type of stress we call as a hypostress. That is not. So most of the domain they can talk about the distress. It's a very dangerous. It's a bad stress. They can quantifying this type of stress. This reason, if we could not diagnosing this distress, it's possible to make the suicide also. They can go to think they make the suicide level. They can go to that level. They can make it. So what are the stress causing a number of biological changes? One is a pulse. That meaning biological changes nothing but the biological parameters. They can change the pulse rate, blood pressure, and the breathing rate increases due to stress level. They can make it. So what is a psychosocial resource? That is protecting people from the psychological and physiological illness, help with the recovery of the both type of the illness. Once you can quantifying the stress, we can give the some therapy or treatment. That is an example. Now, one of the best example I will tell them. If the most of the software company people, they give the every 30 minutes or 45 minutes, they give the small break. 5 seconds then. Actual logic behind is to relieve the stress. Similarly, if you move on to the shop floor, manufacturing sector, after 1.5 hour, 1 hour 30 minutes job, they give the 15-minute break or 20-minute break. So what are this break actually can play a role for relieving the stress? Some stress relaxation. That is not. So only we can quantifying the stress, diagnosing of the stress, we can find out after diagnosing the stress, we can give some therapy, biofeedback therapy or some other we can make it. So stress produces physiological arousal, increasing the muscle tension and reduce the motor coordination. So whenever your stress happen, your brain cannot willingness to do work. What your body's ability, but still brain cannot give the control mechanism. They are not given any control mechanism to your coordination of the movement. Coordination is motor coordination, nothing but the movement of your organ, hand, leg, all the thing, meaning here. So increasing muscle tension and reduce the motor coordination. They reduce the motor coordination. Simple one example, you are planning to write some text in the paper. Suppose you are stressful, we don't get any coordination. Your handwritten is going to some not very good handwritten. They can go to that is not. So they can actually play a role. That is the meaning of motor coordination. So in psychological resource, alter the cognitive appreciation of the potential, threatening the situation, helping reduce the physiological stress response. We want to reduce the physiological stress response. They can make it. So what is the stress? How lifestyle can be affected due to stress, lifestyle disorders, backache and sleepiness. Whenever person is stressed, they do not get the proper sleep. Sleep disorders, ultimately they create the sleep disorders. Person is a stressful condition. Next one is hypoacidity, gas. They can make it. Chronic fatigue syndrome. That is heart disease, diabetics, and even cancer. So we don't cure the stress, even they go to cancer level. Cancer not only due to external factor, they can make it. Also, they can make it your stress also play a role for your cancer treatment. They can make it. So whenever you are not diagnosing the stress, they can go to upper extremity level also. Your healthcare go to it. So heart disease also play a role for stress. They can make it. Reason, due to stress, they are not remove the cholesterol in the blood vessels. Reason, it was a very stressful condition. They can make it. So the cholesterol can be deposited in the blood vessels automatically. That is not. So cholesterol deposition automatically they produce some heart abnormality, heart disease related things. They produce a diabetics also and even cancer. That is not. So this is now what actually they infer. Stress is one of the crucial play role for healthcare field, health disease. That is not some other thing. So here, what I told them, stress is nothing but the brain related stress. It's a mental stress, not physical stress. I told them what is a physical stress, but here is a mental stress. How your mental stress can be made in their system. Okay, this picture can give the idea of the autism. So see first picture, they give many document in front of here, there is many document is there. That is not. But still that people, they're already stressed. That person is already stressed. But in front of there is many document. They finish the document completely, entire things within 1 hour, half an hour. But whatever that person still try to finish this document. After once they are making exhaustion level, they are going to exhausted level. That is exhausted is bust, look like is bust. They can happen anything. They can go to once person go to exhausted level, anything can happen in the healthcare, in his health. They can make it. So there is an alarm state, that is a resistance level of the normal. This is normal stage. There is alarm. Still they can make it resist. Our body can resist, but we don't take any relaxation, any rest. Still you continue the work. They go to exhaustion level. That only this picture actually give them. So whenever you feel some stressful condition, we can stop. You can relax them.
Sir, your voice is not audible, sir. Sir?
Madam, my voice is audible or still?
Okay, sir. It's okay, sir.
Okay. Suddenly I think some network issues my side
Okay.
probably. That's
No problem.
okay. So what actually making, I already told them stress is one of the crucial pillars. So you want diagnosing stress level. What are the physical effect of stress? They can make it. One is for stress and a negative emotion. They make the emotion level very angry. That is emotion. That is so unhealthy behavior. That is smoking, drinking, poor nutrition, and sleep. If you are not diagnosing the stress, they go to unhealthy behavior. People automatically go to smoking. They can make it drinking, poor nutrition, and sleep. All the things are they can make it. So release of the stress hormone also. Corresponding, they're releasing in the body inside. Due to stress, they are releasing some other hormones. They can make it. These hormones can crucial play a role for heart disease and immunosuppression, autonomical nervous system affect the headache and hypertension, all the things. This all the things are due to stress only, due to your mental stress, due to brain stressful condition, all the things are happen. So this can give that, this slide can give them. So stress is one of the very important factor in to diagnosing for any person. It's a gender wise or students level, any aged people also we can find out the stress level. Okay, next another factor is fatigue. Stress and fatigue. Stress and fatigue more or less same. It's not a completely different definition. That is not. So what is a fatigue? It's a subjective experience of tiredness and unwillingness to continue the work. That itself I told them, your stress and fatigue is not a huge difference. More or less same. They can come to your same. They can. So what is your fatigue? Is a unwillingness. It could not possible to unwillingness to continue the work. So components of the fatigue syndrome are largely has been concerned in physiologists. There is a two type of fatigue. There is a mental fatigue and physical fatigue. In biomedical side, in healthcare side, they talk about the mental and physical. Anything related with brain, anything related to brain is called as a mental fatigue. Anything related with the muscle, musculoskeletal, muscle or working activity, they're called as a physical fatigue. That is not. So, and similarly, depending upon the workplace, the fatigue can be varying. They can make it. So if the depending upon the workplace, if you move on to the software industrial, mental fatigue is a crucial play role. Reason they are not doing any physical activity. If the software people, they are not doing any physical activity. They do only given to all the workload in the brain. They can thinking, coding level, all the thing. So next, similarly, we move on to the pilot, cockpit pilot. It's an aircraft pilot or cockpit or aircraft or defense pilot, all the thing. That is a fire flight pilot, all the thing. They are also mainly, they talk about the first is a cognitive, next only physical. They take the control action quickly. What are the commands they are receiving from the ground control room? It's a example, pilot, fight pilot. They can example pilot in the fighter pilot. What will happen? They give the quick response quickly. They are missile, they are sending the missile, they are targeting the missile, they can give them, so they quickly respond. So that case they can consider some mental fatigue. They can talk about the mental fatigue. So what is a physical fatigue? Whenever you move on to the shop floor, it's a manufacturing sector, industrial sector, some other mechanical industrial sector, they more worried about the physical fatigue. Reason, in most of the manufacturing sector, car manufacturing or two-wheeler manufacturing, they are not given more workload to brain. They give the more workload to muscle or musculoskeletal. So that time they worried about the physical fatigue. So this fatigue is a common, but this depending upon the your working place, we can take it a mental fatigue or physical fatigue. And suppose you want to do some studies, fatigue related studies for human health, that is first check the which condition, working environmental. They are working in manufacturing sector, we can consider physical fatigue. They are working in other side, software industrial or some other sector, we can consider mental fatigue. They can make it. So what are the fatigue affecting cognitive function? If the fatigue affected in the mental, now we talk about mental fatigue. We don't talk about the physical fatigue. Reason, today topic is a cognitive. I already, my session talk is only cognitive. So we mainly concentrate the brain only. We don't concentrate the muscle related, musculoskeletal issues. It's muscle related. That is. So whenever fatigue affecting cognitive function, alertness, attention level, working memory, long-term memory recall, situation awareness, judgment, executing control, all the things are affected. So all the functions are they are affecting in this system. They can make it. So this is about the your mental fatigue. They can make it. Sorry, that is okay. So what happened? Your fatigue affected cognitive function. One is alertness, attention. These are the things are affected due to fatigue, mental fatigue. That is so fatigue lead to reduce efficiency and unwillingness to do the work. Psychophysiological measure have been used number of real world environmental to monitoring operator workload using psychophysiological. Psycho is nothing but the mental, physiological nothing but the your signal, physiological signal is measure have been used for number of real world environmental to monitor the operator workload, brain workload, not physical workload, is a mental workload. They can find out. So what is your cognitive fatigue is most of the main field where there is very important in the cognitive fatigue. One is aviation, transport industrial, aerospace, military and industrial setting. Symptom, what are symptoms they can make in the cognitive fatigue? That is impairment of attention, concentration, memory, motivation, decision making. That is so one of the best example. Now see them, some of the students initially up to +2 score is very very good. Once they move on to the higher studies, their study level is very decreases. Reason, they are making some fatigue or stress due to some external factor. That is so we can identify which factor that person creating the stress. Next, identify the stress. Once we can diagnosing the stress, that students can make it good level. One more time. That is so their concentration, steady state concentration can reduce, motivation, decision making, all the things are reduced due to cognitive fatigue. They can make it. So nowadays they are using, instead of they are using simulator in the aviation and space industrial, they are not putting the real, they are not putting the human in the pilot. That is a fight pilot. That is fighter pilot. They are not putting the human in the fighter pilot. That is they create a scenario, simulator scenario. They can check the what is the person is fatigue or tired, what happened, they can make it. That is in research purpose, simulator are used to make up the new advanced driver assistive system. Area for human factor, monitoring driver performance, behavior, all the things. So most of the nowadays car manufacturing automobile sector, they design a simulator. They're designing different simulator. If we move on to the defense, in defense, they are designing a tank simulator, Once they're putting inside the human, that is a simulator. But it's a simulator, nothing but not only video game, exact tank, their tank is not moving. But if we can get the feeling vibration of the tank, we can get the feeling of movement of moving the tank, all the thing. But we get the feeling, but they are not exactly moving. So they're testing in the simulator. They are not, most of they are testing. So what are the getting result in the simulator? We move on to the real field. Only 2 to 3% variation, not huge variation. What are the you are concluding result in the simulator? This go to real field, real scenario. Is not a huge variation of your result. Only 2 to 3% variation of your result. They can make it. So what are the fatigue type? We can make it as a physiological for symptom and effect of fatigue, reduce a psychophysiological stimulus. If you move on to the cognitive, reduce alertness and vigilance level, information processing and decision making longer. If you move on to the motor level category, reaction time increases when critical events occur. Control reactions are more valuable and less effective. Reduce the preparedness of the reactor. Okay, what is the meaning of here? Cognitive and motor. Your cognitive nothing due to stress, your thinking level reduce, memory recall, all the things. What is a motor is nothing but your movement of organ, movement of leg, hand, all the things. So this mental fatigue also reflecting in the movement of organ. Reason, your movement of organ can be controlled in the brain. Brain can be controlled. Brain only control your movement of organ. They can control your walking pattern. They can control your just position, or that is the postural, different postural movement. The brain can control, that is not. So only here motor also crucial play role. Not only cognitive, motor also they can consider. So generally they are approaching for fatigue reduction. One is a physiological measure. Physiological measure is nothing but the ECG, EMG, some physiological signal. That is not. Neurobehavioral modeling, they can use some modeling, neurobehavioral modeling, neuron modeling. They can construct the neuronal modeling. They can find out the fatigue reduction. Other one is a performance test. They can go use the reaction test. How there are psychological tests. There is no. So these are three broad technique they can use for find out the fatigue reduction technique. That is no. So there is a various measure of cognitive workload. What are different technique? If you move on to the brain related measure, they can use a functional magnetic, fMRI, resonance imaging, electroencephalogram, event related potential. So last two things are signal side, electroencephalogram, EEG, and ERP, event related potential, ERP. These two are related with their signal side. First two are related with their image side. You want to study the brain function using the functional magnetic, fMRI, functional fMRI. MRI can give the anatomical structure. You want to study the function of the brain, they can use a fMRI. They can make it. So fMRI and MRI, they can resonance imaging can give the brain function modality. If you want to signal one dimensional, this another last two can play a role. Instead of you can use a brain, we can use another technique also for quantifying the cognitive workload, eye related measurement using EOG, one of the best EOG, and blink interval, blink closer duration, blink rate. This all the techniques. It's a electroocculogram, blink related, all the things. Nowadays they are planning to use your driver alertness system. They put the camera in front of the driver. They put the camera. They find out the person is asleep or depression or stress. They find out the sleep of the driver. You can using the eye movement, eye closer, duration, all the things can crucial play role. That is nice. Next, they can use heart related measure also. They can use the ECG and heart rate variability, heart rate and blood volume. These are the things are related. So your workload, subjective workload can be quantified using brain signal or eye related measurement or heart related measurement. We can move on to this one. Okay, so what are the, I told all the things are introduction. What is the neuroscience? What is the neurological disorders? Next, move on to the, what is a cognitive? And in this cognitive, stress and fatigue is a crucial play role for healthcare system. And what is a cognitive? Sorry, what is a fatigue? What is a stress? Next, so next, brain is a crucial play role. Cognitive, when I told them, is a brain. That is here. I don't talk about the in-depth anatomy of the brain. I don't talk about the in-depth anatomy of the brain. What are the lobes of brain? how signals are produced in the brain. That only, I don't give them. Next, move on to signal processing. What are the parameters we can take it? So brain is responsible for processing information, making decision and initiation action on the external environmental. So brain is a CPU, central processing unit, look like your computer. In the computer, CPU is there. That is same, our human body, brain is important thing. Reason, so whenever your brain is dead, it's a coma, but still person is live. Still person is live, but they are not possible to do any task. It's a simply live. Person is live only, but brain is dead. It's a move on to the coma. They can make it. Understand? So brain is a very, very important elements or important organ in the human system. So cognitive effect involves sustained vigilance, selecting attention, complex decision making, and perception motor control skill also. Not only memory recall all the thing, they can give the control mechanism to our organs, motors, all the joints, they can give them. So measure of the electrical activity of the brains are seem to many to be direct way of determining the cognitive demand placed upon the operator. Instead of, we can use a brain signal information, we can get the performance of the concerned person or cognitive level of the concerned person. So brain is one of the very important things. Using the signal information, we can get the some of the information. Example, attention level. What about vigilance level of the concerned corresponding person? This person is a stress or cognitive performance. Anything we can predict using the signal. So what is the numerous physiological indicators are available to measuring level of alertness, that only level of alertness. One of the things, EEG is a better tools. EEG signal considered to be one of the best available technique. It's a non-invasive study, surface level analysis. We don't take the needle EEG. It's a single neuron firing. We don't want single neuron firing. We can take the surface level. That is nice. So one advantage is a very low cost. It's not very, that is nice. But your spatial resolution can be somewhat reduced in EEG. That case, you want good prediction, move on to the imaging side, fMRI. They can find out the brain function. They can make it. So your EEG is a electrical pattern recorded surface of the brain. They can make it. It's a non-stationary signal. Actually, say, okay, what is the difference actually? Already, most of the electron engineering background only, we know what is a periodic and stationary, non-stationary, meaning most of them. So whenever we consider as ECG signal, ECG is a electrical signature generated from the heart. So in the ECG signal, what will happen? In ECG signal, your ECG signal is some pattern. They're having some pattern like structure, P-way, QRS complex. But if you see the brain signal, it does not contain any pattern. It's a random signal. It's a random signal. We don't see, if we're seeing the EEG, we could not possibly predict anything. Seeing the EEG waveform, we could not possibly predict anything. But seeing the ECG, at least we can, small information we can possibly predict. That is a difference between the. So most of the your EEG signals are non-stationary. That we can mediate your system. That is nice. So this is a non-stationary signal, is a pattern recorded in the brain. They can mediate. So what are the EEG? What is the EEG? Is nothing. It's an electroencephalogram originating from the cortical neurons. That is a current due to, that is an excitatory postsynaptic potential and inhibitory postsynaptic potential. Produce a voltage drop across the ECG and okay. Now, what are the, you are measuring the EEG's surface level, but you move on to the inside brain. There is a neurons is there. There neuron having synaptic junction. They can make it all the acetylcholine release, all the thing. That is nice. But we can measuring the surface level. That is a dentist can make it. They can make it. So this is actually your neuron, only neuron structure. They can make it axon, dendrite, all the thing. But they having two type of potential. One is inhibitory postsynaptic potential, exhibitory postsynaptic potential. What are the surface level EEG can give you both the things, EPF and IPF, summation of excitatory postsynaptic, inhibitory postsynaptic potential. They can make it. So this is this slide can give the how EEG signal can be generated. Genesis of EEG. See, inside brain there is many neurons. They are firing the neurons. Many location neurons through this is a EEG signal. See, in EEG signal we don't get any information. It's a look like a random signal. That is not. So what are the signal taken from the brain using some electronic devices, electronic system? We can amplify, boost up. Finally, we get the brain signal. That is only is generating EEG signal. So whenever we talk about the EEG signal, there is a 5 rhythms is play role. Rhythms, waveform. 5 rhythms can play role. One is for, we move on to the lower frequency to higher frequency. In lower frequency, they started delta. Next, theta, alpha, beta, gamma. Listen. So depending upon the your study, always the 5 rhythms are appear in the EEG signal, irrespective of what your studies. What your study carried about, irrespective of your studies, all the 5 rhythms are appear, but one rhythm is dominant. All 5 is appear, but one is dominant. Suppose example, sleep study. We are planning to take the sleep disorders, people, EEG activity. In this, delta is dominant. Delta rhythm is dominant. They are also having theta, beta, all the thing, but the dominance is a delta. That is not. If you move on to the relaxed, calm peoples, you can recording the calm people, the relaxed people for EEG recording. In this, alpha is dominant. Remaining rhythm is there, but one rhythm is dominant. They can make it. So this is a corresponding frequency, is a gamma rhythms, is a beta, there is a 30 to 30s. So how will they are segregating these brain rhythms depending upon the frequency separation. So if the gamma is greater than 40 Hz, is amplitude, is a beta 13 to 30 Hz, alpha, they are mainly dominant in the occipital lobe, is vision, occipital look like a vision lobe. That is nice. It's a theta rhythms, delta rhythms, is a spike, and the epilepsy is a seizure. Whenever any person affected seizure, this abnormal neuron firing. Seizure is nothing but the abnormal neuron firing. When person is normal, neuron firings is some threshold level. Whenever person go to seizure level, epilepsy, fits will come. Neurons is firing in abnormal rate. They can make it your system. So whenever we talk about the brain, there is a 5 lobes are there. Lobes. What are the each lobe is a own function. We move on to the your frontal side. Frontal lobe. They are movement of your organ. Front side. Front side is a front side. They are entirely controlling your movement of organ. And similarly, your brain also left side and right side brain. That is now. So left side hand movement can control in the right side of the brain. It's opposite control mechanism. Okay, it's considered as opposite. So it's a frontal lobe for movement coordination. That is now. Next, you move on to the temporal lobe. Temporal is auditory. Your music synthesis. Synthesis of your music, voice, auditory synthesis. That is now. We move on to the occipital. It's a backside. Example, occipital. This is occipital lobe. They can give the visual processing, complete visual processing information. Your brain can process visual processing. What is the meaning of visual processing? Nothing but the color identification, is a movement, dynamic system, all the things. They can make it your system. So if you move on to the memory, parietal lobe is mainly play role for your memory processing. Memory processing, nothing but the short-term memory, long-term memory, all the things are they can make it. That is one of the best example. Whenever you see your friends with the 5th class, that is after 25 years, after 25 years, one more time you are seeing your friend. That is but you don't know exact name of the person, but you know is your classmate. At least what happened? They do your long-term memory. They go and matching your system. This person image go and matching inside the brain. They tell them this person is your classmate, but we forget the name. We does not know after 25 years or 30 years. But so they take the retrieve the memory. They go and retrieve the memory. So image go and take it to your memory where this exactly they are finally interpreting their memory. So your parietal lobe, next one more your central lobe. Your central lobe mainly play role for hormonal, thyroid gland, all the hormonal function can be controlled in the temporal lobe. So our brain having 5 lobes, each lobe is one function. One lobe for controlling the vision, one lobe for auditory, all the things they can crucial play role. So EEG, I told you, EEG is a very powerful tools field of neurological and clinical neurophysiological to obtain the basic pattern of the individual. I want basic pattern of EEG. Tell that person close the eye and relax. Relax, not thinking. Close and relax. That is nice. So that time your alpha activities are. So alpha activity is induced by closing eye and relaxed time. So whenever person is opening the eye, alpha activity disappear. They move on to the theta or beta depending upon them. That person is stressful condition is a theta. That person is active condition, beta is dominant. That is nice. So you want basic pattern, tell them person is close eye, relax, they can make it. So whenever for each recording, come to each recording side, there is a two type of recording procedure they can make it. One is for unipolar recording and bipolar recording. Unipolar recording meaning you take a interest point of interest with reference side. That is called as unipolar. That is see here reference is your earlobe and your some active side. That type of arrangement is called as unipolar EEG recording. What is a bipolar EEG recording? Nothing with both are point of interest. Both are, we don't consider it a reference here. Both are active side. Both are considered as active type. To find the difference between this active side, that is called as a bipolar EEG recording. So we can do any recording. Unipolar recording also, bipolar recording also. Before your recording, we can configure your system, but configure your hardware. We need a unipolar recording or bipolar recording. So this is your each recording type. Bipolar how will you look like, and unipolar recording how will you look like. They can make it. So in bipolar recording, potential difference, but unipolar recording, they are not given potential difference. With the ground, they give the electrical activity corresponding active side. They can give them. So whenever in EEG, there is some standard is there, placement of electrode standard. They can make it. They call it a 10-20 system. They take the brain measurement, Nasion to Union, that is nose to head, backside of bone. That is one bone backside. They take the measurement. Similarly, they take left ear to right ear, earlobe. They can make it. So they take the left ear to right earlobe, Nasion to Union. They measuring entire dimension using the measuring tape. They make the 10%, 20%, 10%, 20% meaning. That is called as a 10-20. First, they taking 10%. They make the frontal lobe, all the thing. They move on to the 20%, 20%, 20-20. Finally, 100% they can achieve. So this is a standard for 10-20 system. It's a valid standard. Whenever you want recording EEG, you must follow the 10-20 system, electrode placement. In this, even number denote the right side of the head and a odd number is the left side. So whenever this system, we can place the F7. F7 is F is a frontal. F letter indicates the frontal. This 7 indicates the left side. Odd number. 7 is odd number. So left side and the right side. During your recording, you want put it their notation is O2. O is occipital. Letter. First letter indicates the your lobe. Which lobe corresponding? This number indicates the left side or right side brain. Their number, odd number, they indicate the left side brain. Even number indicate the right side of the brain. They can make it well. So this is actually what I told them, 10-20 electrode placement. They are taking, measuring Nasion to Union, front and back. They put the 10%, 20%, 20%, 20%, they put the electrode. They can make it your frontal lobe. So what is that this Z can indicate? PZ, FZ, all the thing. So your PZ, FZ, all the thing indicate the center, exact center. They are not left side, right side. Center of the point, center point, your brain center point. If the odd number is a left side, even number is a right side. But whenever you put in the Z, it's an axis point, center of the brain. They can make it your system. So I already told them each electrode placement also crucial player. Suppose you want to find out the attention level, person attention level, we can put FP1, exact FP1. Suppose you want study the verbal expression, that person having some expression, verbal problem, they can make it. We can more concentrate F7. Recording the F7 location for each signal, we can find out the verbal location. So each having its own function, they can make it. You want judgment, anything, we can take the FP2 EEG recording. That is not. You want emotional memory, cognitive processing. So each having its own process, depending upon your application, you select corresponding electrode placement. They can make it. You want verbal memory, take the T3, verbal understanding, T5, all the things are, we can consider. We can. Finally, A1, A2 is a earlobe for reference. They can give the reference or neutral point. They can make it your system. So this is common. Whenever you are, they need a electrode, they need a electronic side amplifier. We need. They are using a AGCL. Is a nowadays they are coming to nanotube CNT electrode, carbon nanotube electrode. It's a small, very dry electrode. We don't want any applying the gel. Dry electrode. Now technology development, they are producing the dry electrode. There is a small nanotubes, carbon nanotubes, particles they are putting. They can. So whenever you use the CNT, carbon nanotube electrode, no need for any applying the gel. It's a dry electrode. They can make it. Nowadays, they are putting in the band, headband. They are automatically collecting the EEG signal, brain signal. That is nice. So one of the best for wet electrode instead of dry electrode, they are applying the gel to reduce the impedance. Reason, whenever recording EEG is a very many factors play a role. It's a very difficult to recording the signal from the brain. Reason, you are recording the signal from the brain in surface level above them. So in the above, there is a many layers are crossing. Your signal crossing from the many layers coming from the above of the brain. So already your skull is very hard tissue. Impedance is very high. So getting what are the signal getting above the brain is a microvolts, not millivolts range. But if you are taking ECG, millivolts range. But brain signal, we getting electrode, get the microvolts. So we need that much of amplifier system, we can do it. They can make it. So this is somehow the EEG waveform. Suppose there is mental arithmetic task, which rhythm is dominant, all the things. During high workload condition, whatever alpha decreases and the theta increases, during workload condition, they can make it. They can make it. So these are this slide can give your brain wave rhythms. Corresponding cognitive activity. Corresponding cognitive activity, whatever this brain rhythms can change. Which rhythm is dominant, which one is less, they can make it. So this is some of the EEG application side. They can make it your system. Clinical side, non-clinical side also. This is a non-clinical side. We can find out the alertness monitoring, lie detector. That is most of the foreign country, they are using this technique. The person tell them truth or they're not. So determine the quantifying reaction time, event related potential, biofeedback therapy can improve the treatment. They can improve the brain function. So this is a merit, a relative demerit for using imaging modality for brain, signal modality. This slide can give the idea of imaging modality, they can make it. So this is about the brain. So what are the in brain? We can take the EEG signal. In brain, how many lobes are there? In EEG, what are the rhythms are there? This can give them. Next, we move on to the application side. That is nice. Okay. Now I can give small break. Yours having any doubt, any clarification? Any up to having any doubt, any clarification, can make it. Madam, my voice is audible?
Yes, sir.
Okay,
Yes, audible, sir. Audible.
Okay. Any doubt, any clarification up to technically? Stress or brain related information. Remaining now we want to only application side. Application side. We can study some application in cognitive application side. Finally, treatment. Okay, I think no doubt, I understand. Okay, first application we want to the cognitive evaluation of driver performance using. So we can evaluate the driver performance in two ways. One is the physical and mental also. But here more worried about the mental drivers, mental performance. We can evaluate them. So nowadays road accident, road transport is a crucial play role. Primary mechanism link community between the trust economical property. Now moving the goods or our daily wood, all the things, road transport play role. Nowadays road transport play role. So loss of goods and life due to road accident is one of the crucial play role. Now India, road accident is a crucial play role. Per day, at least one accident, person can death due to road accident. Minimum, I told the minimum one. But he will go to maximum many levels. That is not. So to avoid the road accident, all the things, we can quantify the reason. Most of the driver can play role for accident. Truck driver or any taxi driver can do this accident. So due to accident, they are lose his life. Their injuries or sometimes death also happen. They can make it. So we want quantifying the driver performance. So only that is the important of this work. They can make it. So India's second highest number of road accident, over 95,000 death, and China's is an old scenario. That is WHO report, not latest report. They can make it. So fatigue play a direct or contributing the road accident. It's a tiredness, driver tiredness or driver tiredness is a play role for contributing the road accident. They can make it your system. So understanding and identifying the factor that are contributing to reduce the driver performance is a crucial in early detection of the fatigue, increase the road safety. So what is our aim? So what are the factors play role for the driver fatigue. That is to understanding awareness. Suppose we can quantifying the fatigue, that driver is fatigue, we can give some warning signal. You are already very tired, don't drive, stop the drive, you can relax 10 seconds. Reason is a driver does not know is a tired. After extreme condition only driver know that also. His perception is go to extreme level. After extreme level only driver can understand he is a very tired. But you are using some device, electronic system, we can predict this fatigue in early stage. The early stage you can find out the fatigue level. They can, so you are detecting the fatigue in early level, they give some warning information, warning signal to drivers. That is only here. It's a critical to early detection of the fatigue, increase the road safety. Road safety, we can make it. So these are the things according to the National Transport Safety Board, 30 to 40% of heavy truck accidents are happen. So driver fatigue is due to lack of motivation, degradation of the sensory and somatic awareness, and cognitive aspect. Cognitive aspect also is a memory, attention level, is a attention, judgment, all the things are reduced. Is a cognitive, anything. So we can find out the cognitive performance of the drivers, we can avoid the road accident. We can give the warning signal or can make it. So is a cognitive fatigue was determined using behavioral incidents or subjective measures such as a reaction time, error rate, or subjective scale. Instead of brain signal, we can use a behavioral incident, behavioral measurement also, we can use them. So behavioral incidents or subjective measure cannot provide a momentum to momentum. What are the, we can say the behavioral response? They can give the time to time. What is a moment to moment is nothing but the time to time. Each seconds, they are not given behavior. They can give final overall driver after driving, after 1 hour driving, they can give the behavioral response. But our aim is time to time, what is a person behavior or drivers, what is the response going on? That is so only for time to time or moment to moment, we can use a EEG signal, brain signal. We can. So behavioral incidents or subjective measure cannot provide a moment to moment flexion of the cognitive fatigue, and a resultant can be affected by the emotion of the subject. We can make it. So for cognitive fatigue, during cognitive fatigue, theta, alpha, beta rhythms are increased using this brain rhythms. We can find out the person is fatigue, or that is cognitive fatigue or alertness. It's a no stressful condition. So they are reducing the beta rhythm. Using this two or three rhythms, we can find out the what is a cognitive level of the drivers. Is a tired or still is alert, that person. So monitoring EEG signal in both on-road and simulated situation, we can predict the driver alertness level. Not only in on-road, driver simulator also there, we can study in simulator also, we can possible. So we can frame the algorithm for detecting the driver performance to quantifying the EEG signal. So driver performance or continuously detector is a cognitive using the 4 feature extracted from the EEG signal. We can extract the 4 feature, is nothing but 4 rhythms from the EEG signal. So relative wavelet packet analysis, this is signal processing. Okay, this is signal processing side. We can use a wavelet packet, wavelet domain technique. We can find out the theta, alpha, beta, and the ratio also. This 4 parameters, every time moment we can track the parameters. How these parameters can be fluctuation or varying with each 1 minute or each 1 second. We can, using this parameter, we can tell them person is go to extremely stressful condition or still is okay. They can make it your system. So these are the signal processing domain. We can extract the relative wavelet packet energy from this EEG signal. These are the algorithm. You can make some algorithm. Suppose these are the rhythms are very dominant with the current, with the previous value. Current time interval with the previous time interval, we can compare. We can tell them person is cognitive fatigue, stop driving, otherwise still continue, we can drive. They can make it. So we can compare in the present time interval with the previous time interval. This feature, we can tell them. Still, we don't, in this work, we don't apply any machine learning technique or anything. It's a normal basic work only. We don't apply any machine learning technique or a deep learning technique to find out that is not. If the cognitive fatigue occur continuously for 4 or 5 times, they can tell them stop to drive, take rest, relax, they can make it. So this is a GI, graphical user interface code developed to find out the driver drowsiness level or cognitive level of the drivers. This picture can give them here. In this work, I don't talk about the EMG side. Reason today topic is a brain related, so I given. We also quantifying the muscle performance also, not only brain, muscle also. physical fatigue also. So both physical and mental fatigue. In this work we can, but here I can give only for mental fatigue. I give all the result relative to mental fatigue. So this is simulated driving. We done a simulated driving. It's not real time driving. We can quantifying the driver performance. You can make it. So conclusion about the present study or the first study, proposed algorithm clearly indicate the time occurrence of the cognitive and physical fatigue. Physiological output of the simulator study aim to focus training of the weak muscles and mental stress relaxation with a rehabilitation program for drivers. This will lead to better driving and prevent accident in the real world. So what are the simulator study? We can get some basic result about the corresponding drivers. Suppose we are mentally very tired. Within the half an hour result, we can give the some rehabilitation training, mental relaxation training. That is not. So simulator study can give the result about the driver. What are the level of the driver present during driving? Within the 30 minutes result, their driver is very tired. We can give the some training for the driver, relaxation training, rehabilitation training. We can provide them. Once we go to real time fielding, at least they can improve them. They can make it your system. So this is conclusion about our first study. They can make it. So we move on to the second side application in students. In first study, we talk about the driver. But if we move on to the cognitive workload for the students, college students, what will happen? And the gender-wise comparison also. So cognitive workload is using machine learning. In this, we can use a ML algorithm to find out the person, the students having low workload or a medium workload or high workload. So whenever person go to high workload, is a very dangerous. We can give some treatment. Whenever you find out some people having high workload condition, we can give some rehabilitation therapy for that student. Now we can consider as students. So our Indian as a population 1.3 million, out of 98% people suffering from the stress and workload condition. That is no human being expected from the stress, other workload. Nobody can escape from this stress. You must have stress, but this stress level can be varied. That's all. No human being cannot possibly escape from this stress. That is, but the stress level can be varied. They can make it. So they can cause us disorders in the that already we studied, headache, all the things they can. So cognitive workload is a crucial play role for working memory, all the things making. So this can give the students level, school students, they can make it. We ask the question. That is not. Most of the people, if you are more on to the junior and senior level, they can make it. There is frequently they are affecting the stress. Frequently, their red color can give the frequently they are affecting the stress. They can make it. So only we want to more worried about the stress level quantification for students. They can. So this can give the motivation. This study of motivation. This study we can more concentrate on the students level instead of the higher level people's age of younger elder people's. We move on to the younger people's stress level. So what is this objective? To develop a algorithm to extract the feature and a classification of the cognitive level of the students. That is not. Students, what happens is a middle level, low level cognitive workload or middle level or high level. They can make it. They can make this. We can frame some hypothesis also. I already told them gender-wise comparison also. Female having higher workload condition than male. We can make some hypothesis to prove them which machine learning classifier algorithm, decision 3 or SVM classifier is better for your things. So this is a general flow diagram, how your stress level quantification we can make it. We can acquiring the EEG signal from the students using wireless system. We can do some pre-processing in feature extraction. This feature can be given to machine learning technique, ML algorithm, to find out the stress level or workload level. Is a low workload, high workload or medium workload. They can predict them. We consider as a 12 subjects, 6 male and 6 female. These are the subject summary. What is the height, weight of the subject? More or less age between the only college students. They can make it up to 24, 19 to 24 age. They can make it. So we can classify first 0 to 3 minutes a low workload state, 3 to 6 medium workload, 16 to 14 is high workload. We can give some task after all the workload condition. We can record the EEG signal. Finally, during rest period also we can record them. 14 to 17 minutes rest state, we can make it. So this is a electrode placement. We consider as a frontal, parietal, occipital lobes. This is actually setup. This is equipment. This is EEG equipment. Is a wireless system. It's a E motive. They can make it. So electrode were placed in 18 location, left side and right side brain, they can make it. This FEZ, they are indicating the electrode location, they can make it to your system. Okay, I think doubt, somebody having doubt. Any clarification?
Dear participants, if you have any doubts, you can just clarify with browser.
I think somebody raised a hand. No, that is only I stopped here.
Mr. Sanjeev Limbu, you can just unmute yourself and talk, please.
Yeah.
Sanjeev sir is waiting for you.
Sanju?
It's okay, sir. You carry on. Sir, proceed, sir.
Oh, okay, I think. Okay. So this is your electrode placement for students, college students, stress level quantification. We give some cognitive load. Cognitive work is some psychoanalytic task. We can provide the psychoanalytic task. This is a Unopia. It's a device. Is Unopia. It's a wireless system. They can is a small box. It's a small backside. Is a yellow color. Can is a amplifying. You are filtering all the things through. They can Bluetooth or wireless system. It can transmit your information to your recording system. They can make it. So display and storage and Bluetooth dongle is a sampling frequency of 500. We can give some other cognitive workload task, mathematical task, or we can see some animal press. We see another animals don't press. It's a reaction type. How fast they are reacting with it. It's a workload. It's a look like a workload. We can make scenario can make the workload for the system. So after recording each signal, we can extract the 14 features. We can extract the some other time domain feature. These are the frequency domain feature. It's a wavelet domain feature. We find out the cognitive workload. We find out the workload level. Actually, what is our aim? What is the student's workload level? These students having low workload or medium or high workload. We can predict them. That concerned person having low workload condition or medium workload within 20 minutes duration. Within 20 minutes duration. So here we can use a classifier. They can use a machine ML technique. They are using the classifier. So consider the parameter that need to be learned from the training data set and the testing data set. In training data set, we can use a website database. Many databases there. Using the database, we can train our network or train our algorithm. What are the, we are taking your 6 or 9 peoples. They can use for testing. They can make it. After learning, the classifier able to predict the new data and has not been used for training data set. The performance of the classifier is tested in the different data set. That only told them performance are different data set. We can make it. So this is a confusion matrix. We don't know in-depth information. We can use a KNN classifier and SVM classifier, confusion network, how they can make it. It's a scatter plot for KNN classifier and a scatter plot for SVM classifier. They can make it. So here, what is a classifier is nothing but they classify low workload, medium or high workload. 3 classifier. Yeah. Anything? Okay. Here we can classify only 3 levels, low, medium or high workload. So this is a classifier result. In this, we can get the decision tree with a disabled PCA, principal components analysis, meaning principal components, we achieve 98%. Fine tree, we achieve 98% as compared to remaining classifier KNN, all the decision tree. Many classifier you can make it. That is this is your training and testing data set. You can make it. So here we conclude them. This study we conclude is a female having higher workload than male subject with a similar male having higher workload, low workload condition than female subject. So using classifier, SVM and your decision tree can give the good accurate of classification. So this is my last topic. In last topic, I put the therapy side. Therapy. What are the, we studied first 2 application, only application side. Can I use some therapy? Can you use some? So can I use a music as a therapy for stress relaxation or improving the performance? This one. So effect of music on brain function using EEG. You can consider EEG, how music can play a role. They can improve the working memory. They improve the cognitive performance. They can make it. We don't know in-depth functions. So nowadays, most of the people's depression, anxiety, all the things, they can make it. This slide can give the how important our work. Music can be used as a therapy. So what are the benefit of music? One is a positive effect of hormonal system, boosting learning inference, learning ability, reduce the mental fatigue, day-to-day activity can improve. These are the advantage of using music as a therapy. So first study, we consider three different type of music. One is a jazz, Carnatic, and hard rock. All the things are his own way. We know jazz music, Carnatic music, hard rock. This playing these three music, how will the brain can play role? Brain function using EEG signal. We can record the EEG signal during the listening the three music. For subject, we can record them. Here we consider each subject. These are subject details. This is experiment protocol. First 30 seconds, eye relax, eye close condition. First 1 minute, without music, we can do some cognitive workload. Next, one type of music, do the cognitive workload. Next, without music, cognitive workload. Next, another type of music, we can. Now we can study how this three music can play a role for improving the cognitive workload, improving the cognitive performance, mental performance, they can make it. So this study actually carried about in SSN college. One of my PhD scholar actually done this study. They can make it. So they're recording the EEG signal. They can make it. Simultaneously, they're recording the cardiovascular parameters, also BP, all the thing. But this present talk, I consider only EEG related result only. Few things in cardiovascular things. This is a EEG signal. How will it look like during recording this one? This is a mathematical task, mental task we can give during listening the music time. Music time. So these are the signal processing side. They can take the EEG signal, noise removal, spectral analysis. Some other feature we can extract it during we done some statistical analysis. Finally, we conclude some results. That is nice. So this is result for JAWS music for alpha power without music without workload with mental workload. What will happen? This is for C set location. We don't want in-depth information. All the thing. Next we can. This is Carnatic music. What are the happen during beta frequency for frontal lobe and the central lobe. This is for hard rocks. That is not. But we move on to the conclusion side. Actually, what we infer from this. So while listening to Carnatic music, beta activities were high during mental task. All the three locations when compared to JAWS. What were infer? Your Carnatic music can improve your cognitive performance. Carnatic music as compared to JAWS and hard rocks. As compared to JAWS and hard rocks, Carnatic music can automatically improve the cognitive performance. They can make it. When jaw music played, whenever you are playing jaw music, spectral power of the theta band is significantly high season when compared to Carnatic and hard rocks. They can make it. Hard rocks does not show any significant difference between any location. Hard rocks, what are you are playing? Hard rock pitch is different. Hard rock pitch is very different from that Carnatic and JAWS music. So hard rock does not show any significant improvement in the cognitive performance. To support still our study, we can make it. So whether JAWS or Carnatic will improve the mental talk performance, we need. So now we can omit the hard rocks. Hard rock can be omitted. Now within the Carnatic JAWS, which one is a good effect? We need further study. But still we don't conclude. But the preliminary result we conclude Carnatic is better. But still we need continue this work. Within the Carnatic or hard JAWS also somewhat okay. But if you want good result prediction, we need some more study. That is present. We can omit the hard rock. Hard rock is waste. They are not improving the cognitive performance. That is not. Carnatic JAWS somewhat okay. We can make it. Still want good conclusion. We need continue this work. We can make it. In studies too, what will happen? Instead of Carnatic hard rock and JAWS music, we can consider music interest. One person interest for Ilayaraja, other person interested for A.R. Rahman music. So what we told them, each subject, they tell them bring your music of interest, music of uninterested music. They bring, subject can bring the music. We are not tell them forcing the music. We are not forcing, you can listen this music. Now we can subject interest music. That is actually second study. So the study effect like and dislike music on the cardiovascular system and also your brain signal also we can find out. So what is the difference between the study 1 and study 2? Study 1, we are forcing to listen the Carnatic music. We are forcing to listen the jaw music. But in study 2, subject interest of music. How they can play a role for cognitive performance. They can make it. We can find out some cardiovascular parameters also, brain signal also. We can make it. So here also 8 subject we are recurring. These are the experimental protocol. We can make it your system. Here also how will cognitive performance and improve using music. These are the recording we done. We can make it your system. For this is a data analysis for cardiovascular parameters, not EEG, cardiovascular parameters. So this is a cardiovascular parameters result for like and dislike music. One person bring A.R. Rahman is a like music. Same person, they bring the Ilayaraja is a dislike music. How they can make it? Like music is a dislike, how they can play role. That is not. So this is a music involvement score. They can make it. So what is the conclusion about your cardiovascular parameter? What we conclude? Like music increases blood pressure and heart rate when compared to dislike music. Whenever. So subjects were more involved while listening to music of like, more involvement. Whenever as compared to dislike music, this involvement was significantly high when compared to music of dislike. Like music can stimulate sympathetic nerve system. That only told them. Whenever your music of interest, they can stimulating the sympathetic nervous system. Music of dislike, parasympathetic nerve system. That is that changes were reflected in the cardiovascular system parameter like heart rate and blood pressure. So in second study, we don't force to listen this music. There, we can take subject music point of interest. So heart rate and blood pressure increase significantly while listening to music of like when compared to music of dislike. Music of like based on the subjective choice can be used for treating symptom of the depression. Depression. Can I use music of interest can treating a depression or anxiety. Music of like can be used for improving the focus attention, thereby mental task performance can improve. That person we don't force, that person of music interest automatically improve the cognitive performance. Same study, we can use EEG signal. These are the result for music with the mental for that is like music, similarly dislike music, that is an. So stress occur the amplitude of alpha beta rhythms, that is okay. Your rhythms how will it change? We don't bother about this slide actually. How these brain rhythms are changing with the music, dislike music. So what we conclude made is, it indicates that listening like music, what actually? Listening like music without cognitive workload, subject might experience see them without like music. Indicate the listening like music without cognitive workload, subject might be experiences, that is. But music with the cognitive workload, subject experience stress was low and can be reflected in terms of decreasing beat activity. Meaning, simply without music, you are doing some cognitive workload. Next, cognitive workload with like music. So what they given, without any like music, without music, you are doing cognitive workload, they are increasing the stress level. But you are playing music with doing some task, they reduce the stress level. So now what this study conclude, music as a therapy, treatment for depression or stress level or anxiety, and improve the cognitive workload. That is nice. Instead of only not this music, we can use a Carnatic music, art rocks, jazz, or anything we can play role. We can make it. So this is the finite element analysis. We can make it. That is okay. So I stop my session here. That is nice. So two application side. One is for therapy side. Application side, driver performance for using this. Other one is students. Finally, therapy side for music therapy. Okay. Any doubt? Any clarification from my
Sir,
side?
with sir concluding, is there any doubts? Participants, you can just unmute yourself and ask your doubts.
Anything related to the cognitive, anything neuroscience, not only my presentation doubt, any doubt related to neuroscience.
Sanjeev sir, I could see your hands raised. But I think, sir, he has just raised it by mistake. Just pressed it by mistake.
Okay. Reason I told them, now as compared to image processing, neuroscience is now dominant field. Now still less work carried in India. Our country, the neuroscience is a few works only carrying. But if you move on to the foreign, German, Western, US and German, they are doing a lot of neuroscience work. But our India, there is a less work in the neuroscience field. That is actually.
With sir session, I assume that you don't have any doubts. And I would take immense pleasure in delivering the vote of thanks.
Okay.
It was a wonderful session, sir, indeed. So I would like to personally and on the behalf of the Department of Biomedical Engineering, I would like to thank Dr. K. Adalarsu, Associate Professor, Department of Electronics and Instrumentation Engineering, Sastra University, Tanjavur, for giving a wonderful session on this cognitive neuroscience. Thank you very much, sir. Thank you.
Thank you, sir, for providing this opportunity also.
Thank
Thanks
you, sir.
for,
It's a
Thank you,
pleasure
sir.
for us.
okay, sir. Thank you, sir. I stop.
Thank
The
you.
next,
Okay, sir.
the next session, participants, you can join by 2 o'clock for the next session. And Sudha ma'am, would you like to add on to something? Any instructions you would like to give to the participants?
Sir, nothing, sir. Nothing, sir.
Okay, sir. Thank you. Thank you very much.
Thank you, sir. Thank you, participants. Thank you.